What is a weighted blanket? To improve mental health, we use pills, counseling, hospitals, exercise, herbal supplements, shock therapy, Mediterranean diet, and maybe weighted blankets. That's what today's video is about. Hi, I'm Dr. B. I'm a medical doctor and I like to make medical education videos that I find interesting. Do weighted blankets really work for anxiety and mental health and to help you sleep as advertised? If so, how do they work? And is there really any reliable scientific evidence that they really do work? Weighted blankets are quilted blankets containing multiple pockets, and these pockets are uniformly filled with either polymer pellets or glass beads, something to make them heavy, and they can weigh anywhere from 5 to over 30 pounds. The idea behind using a weighted blanket theoretically is that it provides a deep touch. It's like being embraced in a warm hug that remains constant for you while you sleep or even during the day. The act of hugging has been shown in research studies to have a real effect on neurotransmitters in your brain. Remember those chemicals that your nerves use to talk to each other. And the effect of hugging or touching is similar to that from a massage. And these changes include increasing dopamine, your body's feel-good hormone, and that's important in everything from addiction to cell phones to depression. In addition, touch is thought to increase oxytocin. This is known as the love hormone or cuddle hormone. It makes us feel trusted, connected, and relaxed, and helps you just feel warm and fuzzy. It's especially important in mother-child bonding early on. There's also serotonin, which increases, and this works closely with dopamine. And finally, touch is thought to decrease cortisol. This is the stress hormone that's released during fight or flight. And by decreasing your cortisol, it decreases your blood pressure and your heart rate. Now, imaging studies have shown that touch also activates the brain, specifically the orbital frontal cortex in the brain. That's the portion of your brain just above the orbits on both sides, and it's the same area activated when food or candy tastes sweet or something smells really good. So how do we think this touch works in the body? Well, the mechanical action of touch presses on what are called mechanoreceptors in your skin. And this activates a tiny structure in there, or a series of structures known as Pacinian corpuscles. These are connected to nerves that go all the way to the brain via the vagus nerve. The vagus nerve is the longest nerve in your body and is an important way for your skin to communicate with your brain. And this activation of the vagus nerve is thought to decrease heart rate, decrease blood pressure, which helps you feel relaxed and is important to helping sleep. Now, activation of the vagus nerve is also thought to decrease cortisol, that stress hormone, which may also affect temperature. Lowering your body temperature helps induce sleep. So all of these physiologic changes relating to weighted blankets, to touch, and hugs is nice in theory, but are there really any rigorous scientific studies that show that that really works? And is there any real benefit to weighted blankets, or is it just marketing, advertising hype, or placebo effect? Well, that's where it gets interesting. There are a number of recent and good research studies on weighted blankets in a number of different clinical settings. Let's look at those. First, let's talk about anxiety. There's a 2021 study that looked at using weighted blankets in a very anxious subgroup of people. These were people who were inpatients in a psychiatric facility, and they looked at very strict evaluation of their anxiety levels and looked at their pulse rate as a measurement of their anxiety. Weighted blankets caused a very significant drop in their anxiety and in their pulse rate. Now, a separate subgroup outside of the mental health community was a group of people receiving chemotherapy that they looked at. These individuals received 2 different sessions of chemotherapy, and there was randomization for some to receive weighted blankets and use them, and some not. It was found that anxiety was significantly reduced among those patients who used them and received chemotherapy. And the conclusion was that it can be a non-drug, very safe mechanism to help with anxiety in patients getting chemotherapy. Now, a final look at anxiety reduction in weighted blankets came from a study looking at something completely different. A nice study looked at reducing chronic pain using weighted blankets. And patients were given either a 5-pound or a 15-pound blanket. Patients were randomized to these 2 groups. The group that had a 15-pound weighted blanket had a significantly decreased perception of their chronic pain. But interestingly, the group that was most affected was the people with chronic pain who also experienced a lot of anxiety. Next, let's look at weighted blankets in insomnia. So a fascinating study in 2020 in the Journal of Clinical Sleep looked at a group of patients who already suffered from a number of difficulties: depression, bipolar, generalized anxiety disorder, and ADHD, and randomized these patients to either receiving a weighted blanket or not receiving a weighted blanket. There was a significant improvement in this group's sleep and their daytime activity when they used a weighted blanket. In addition, there's a significant number of people who chose to continue to use the weighted blanket after the time of the study, which was about 12 months. They continued to experience the same benefits, and looking at a significant number of individuals who initially were randomized to no weighted blanket, who then chose to use a weighted blanket, they began to experience the same impressive results of help with their sleep and their daytime activity as the original group who started with weight blankets. Now, one of the mechanisms we think that might be important in this is melatonin, which is an important sleep hormone, and there's a very recent study that looked at weighted blankets might increase melatonin levels as much as 32% if you're using them as you go to bed. Now, the final group we'll talk about is a group of kids with ADHD who were, again, either given or not given weighted blankets. Very significant results. The parents and the children reported much improved satisfactory sleep, improved onset of sleep, continuous sleep with less tossing and turning, and a significant improvement in daytime activities in participation of school and leisure activities. So that's the data for weighted blankets. As you can see, regardless of the proposed mechanism, there appears to be a real effect for individuals with a variety of conditions, anything from pain to ADHD, and it's especially helpful in anxiety and difficulty sleeping. Thanks for watching. If you've enjoyed this video, try these on how social isolation affects mental health, and try this one on narcissistic personality. And please don't forget to hit subscribe.